Hello students, I will show you today how to do a specific suturing technique. See, suturing is an art. So simple thing, inverting suture. That is mainly used in the subcutaneous plane. Many other places also use, whereas in subcutaneous plane, knot should not be outward, knot should be inverted. That is why we will take bite from opposite side, from inside out, from the ipsilateral side or same side, from outside in. Like that you will do, then put the knot. Whereas two and tail end and leading end should be on the same side of the loop. Knot should not be on the opposite side, ideally by principle. Then put the knot. Usually we have to put reef knot from front, from behind, from front, like that. So that is how exactly you will do the inverting suture, mainly for the subcutaneous tissue plane during opposite tissue approximation. So just see the video here. We can see from inside out on the opposite side, from the same side from outside in, inside out, outside in, from inside out, outside in. That's how that it is shown very clearly if you carefully, and that is how exactly you will do the inverting subcutaneous suture. So students, I hope you have understood this very simple but very crucial and important suturing, inverting subcutaneous suture. Thank you very much.